As staff of the American Heart Association, every single one of us are driven by the 2020 Strategic Impact Goal of the American Heart Association. And we know that in order to achieve that goal, it takes our rock-solid execution of programs, advocacy work, fundraising initiatives in our local communities. And those activities will only be stronger if more volunteers are engaged in helping to design and execute the goals and strategies of the AHA. We can just look back in our recent past at many of the most important things we've done as an organization and realize that these things never would have happened without volunteers. I think of things like Get With The Guidelines, 1,400 hospitals in this country, millions of patients whose lives have been impacted because they've received better care in the hospital than they would have without Get With The Guidelines. That program was created by volunteers, is made better by volunteers, and is implemented by volunteer and staff partners in communities throughout this country. Think of our work in advocacy and all of the great success we've had in advocacy over time, from making the air in our communities cleaner, to improving nutrition standards in schools, to increasing funding for the CDC, and all kinds of other programs and initiatives. It's volunteer advocates who have made those things happen. Look at the American Heart Association's research program, the single largest expenditure of the American Heart Association every single year for decades. That program is designed by volunteers. We have thousands of grants that are peer-reviewed by volunteers every single year. That would never happen without volunteers who are passionate for our cause. So when we think of the big end goal that we all are working toward every single day, we need to recognize that our ability to get there together and to be successful will only be magnified by great volunteers who are passionate about our work. And our job as staff, first and foremost, is to bring volunteers into the organization, help them recognize how they can make a difference, help them see the responsibility that they have as volunteers to carry forward the mission of the AHA, and to thank them every single day for the work that they're doing.
So you may be thinking, what's new about volunteerism? Volunteerism has been part of the organization since the Heart Association started. It's volunteers that started the American Heart Association. Why are we talking about it so much now? Why are we creating courses and all these resources around volunteerism? Really, as we started working on our 2020 goal, we said we're only going to reach that goal if we have more volunteers and we engage them more deeply. And so across the organization, we're focused on what are the things we need to do to drive to that? What are the things we need to do from a volunteerism standpoint to reach that 2020 goal? Nancy Brown, our CEO, created my role and a new department around volunteerism to support everything that all of you are doing to make volunteerism even more successful for the AHA.
Relationships with volunteers is one of the most special benefits of working at the American Heart Association. I'm in my 25th year working for the AHA, and I started my work in a community in the former Michigan affiliate. And to this day, volunteers that I worked with 25 years ago remain people that are very close to me today. And that happens because I have valued the contributions they've made to our organization over time, and they have valued the relationship that they've had with me over time. And that's come from mutual respect and ability to share ideas and solutions to problems, and an opportunity that I've taken as a staff person and volunteers have taken as volunteers to recognize that we share a mutual passion, and that passion is for the mission of the American Heart Association. So a special opportunity every single staff person in this organization has is to look at relationships with volunteers not as part of your job, but as part of something you can do to enrich your life, your competencies, your professional network, and it will benefit the AHA for now and for years to come.